Okay, we'll begin tonight's meeting with a salute to our nation's flag.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, at this time we'll enter into a workshop for the purpose of discussing EMS District 2 ambulance services. We have the commissioners for District 6, Clark Cowles Fire Rescue, and District 3. Chief Noor, would you begin?
Yeah, you bet. Do we want to go around and do full introductions of everyone for everyone in the room?
They look to be all familiar faces. I'm not sure who's online.
Good enough. All right. Well, thank you, and thank you for making this a joint meeting of the 3 fire districts. The ambulance service contract that our 3 districts are served by, recognizing a portion of Fire District 3 is served by North Country, but the majority of it is served by EMS 2, is coming up for review for a new contract to go into place in January of 2025. And the contract for EMS 2 is currently piggybacked on the City of Vancouver contract. So we asked, as the fire chiefs here, to be a part of the partnership, sitting in on that or having a seat at the table as part of that. And to date, I would say that I feel like we've been involved or at least informed as what's going on for that. So I've asked Chief Peeler to put together some information and go over it with you. You all should have had a copy of that. He's going to go over exactly what he was meant in that information. Chief Peeler has a long history in the county and was the chief at Fire District 13 in North Country EMS for a long time, so he has a good understanding how the ambulance system works here in the county and a good understanding of what EMS 2 did prior to Vancouver taking over that contract about 10 years ago. But it's going to create some challenges for us as agencies that serve within EMS 2 as first responders, and so we just want to get that information out in front of you to consider some of those things as we move into next year. So, Chief Peeler.
Good evening. Hopefully everyone had a chance to read the document. There's a lot of words on it. I tried to keep it to 1 page. Somehow managed to. I think after adjusting margins a little, it stayed on 1 page. So, but anyway, some of the numbers, some of the questions you guys might have today, we won't be able to answer, and that's because with the consultant that's going on and the fact that there is going to be an RFP for a new ambulance contract going out, a lot of the numbers are being kept secret right now, because if they're out there, ambulance, they could be undercut and underbid and so forth. So we're not allowed to say some of the numbers that we actually have, especially in open public meetings and stuff where ambulance providers could be. So one thing interesting with the current contract is Vancouver collects extensive data on it. So an improvement over the prior one was the amount of data that's required to be collected, and the consultant and City of Vancouver has extensive data on AMR's operation. And they're able to go very granular. So because of that, Fitch & Associates, the consultant that's involved here, was able to take all the existing data and actually take it, if we're going to build an optimized ambulance system knowing all the existing data, this is what it would look like, and this is what it would cost. And from there, they're able to predict what the RFP theoretically is going to have in it, what ambulance providers are going to be bidding on. So the current contract is a 5-year extension of a 5-year contract that was signed. We're going into the last year of that in 24. So 24 is the last year of the 10-year contract. So the RFP Vancouver hopes to have out December, January now is the timeline. They hope to have it out sooner, but that's where they're at right now. And it's kind of because we're throwing a little bit of a wrinkle into it and requesting additional data and different things based on some of the info they've given us. The biggest takeaway is the current ambulance contract as proposed. Well, let me back up a little bit. I think every one of us agree that the existing system is not optimal. Our crews are our citizens are underserved, the crews are underserved, and there's too long response times and too many level zeros. The system is not thriving right now as is. The sad thing is we're being told that even if we want the system status quo without any improvements in the next contract, it will require some form of public subsidy, which means right now the only option we've been presented with is whatever that number ends up being is a cash payment to the ambulance provider to offset, to make them profitable over the life of the contract. What that number is, it's projected to be significant. So it's a number that none of us want to pay. But any questions so far?
Who's pushing that idea that there has to be a subsidy?
The consultant. The consultant, and the data shows that based on, they're involved in multiple contracts around the country. This is a national consultant, probably the premier one, and the Fitch and Associates are the go-to national. They're the Cadillac consultant for EMS system design. So, and based on all the RFPs they've been involved in and seeing what's happening in the thing, plus the current data of profit margins right now, they look at the life of a contract for profit. So they know the contract is going to be a 5 with an extension of 10 years. So over a 10-year period, what is the profit in the 10 years, knowing that the last few years might have no profit. They might be in the red for those last few years. Currently in the current contract, that's where it's at right now. The current system design, the way it is, AMR is in the red. The numbers show that right now. It's hard to believe. I think there's a lot of money there going there, and for-profit company. Now, over the life of the contract, yes, they have made money over the life of the contract, but on this back end. And of course, they're going to bid it based on the back end of the contract, looking at what the profit ability is over the next 10-year cycle.
I was gonna say something.
Chief, do we know what range substantial is?
Those are numbers we're not allowed to talk about.
So I probably should explain up front when we start talking about EMS2. EMS2, EMS District 2 is comprised of unincorporated Clark County and the cities of Battleground, Ridgefield, La Center, and Woodland. And we as the fire districts are not party to EMS2. It's those entities, the cities and the county. We just happen to be the first responders that serve those areas. And we are the ones who are, kind of on that front line of that. So when we talk about some of these things here, we don't have the direct ability to change anything within EMS2, but we are the service providers on first response. So anything that we want to do or any discussions that we need to have with the EMS2 is going to be either elected officials talking to other elected officials, because the EMS2's board is 2 county councilors, currently County Chair Bowerman and Councilor Sue Marshall, and Shane Bowman, Councilor Shane Bowman from the city of Battleground. And that city representative rotates every 2 years. Yeah. So as Ben carries on there, I just want to make sure that we're not talking about these things we're responsible for. We're just impacted by whatever goes on with it.
Point of clarification also on who is pushing this. So they presented the findings to the chiefs, and they suggested that in order to get a contract or to get a bidder, this is what it will take. Something like money or longer response times, those kind of things. So they were I don't know if they were pushing it, but they suggested that that's what the bids will look like.
So when the bid goes out, it's going to have the system design. We believe there could be options in that, bid options with that. We're going to have follow-up meetings with City of Vancouver, who's managing the RFP process. But what they're saying essentially is right now fire districts don't have a seat at the table in the existing contract, as the existing contract is. So if we want a seat at that table moving forward in the current RFP, this is the time we have to insert ourselves into that process right now.
If the commissioners from EMS District 2 will allow it, because they're the ones who hold our hands for that.
As a fire districts, we can provide transport services. We have that ability to, regardless of EMS2.
But either we work with them to get with EMS District 2 to get that, or we would have to step out if we wanted to force our way in?
I think these are some of the questions we need to answer
Yeah, okay.
moving forward, yes.
So, big thing is the status quo right now, to keep the system as it is today, which is underserving our populations and our response crews, is likely going to cost money. Who pays that money? We don't know. City of Vancouver is prepared to pay their portion of it, but who pays that EMS2 portion is a question mark. And then if we want any improvements to the system, it's going to cost more. And they have it broken down on if you want to buy unit hours, if you want to, however you want to do it, they have a breakdown of that. Now, the number they've shown us on what it's going to cost us to subsidize the system, that number potentially is going to go down because they did discover in part of the study that the fee schedule in place right now for base rate for reimbursement is one of the lowest in the region. So as part of this, that fee schedule through, I think City of Vancouver Council is one who has to approve that for a contract and go through that way, which has that trip down. That will offset some of that right there alone, is insurers will be paying more and the user fees will be paying more than today's rate. Rough rule of thumb right now is every transport they average about $500 per transport. And that's based on people with some Cadillac insurance that pay a lot, and some people with zero insurance, and then Medicare, Medicaid. And the average of the entire system comes out to about $500. If you break out, especially certain areas of, well, I had Camas, I looked at Camus's numbers. Camus's reimbursement numbers are, because the populations and the rate of people insured is around $700 versus the $500 of AMR right now. And then they're eligible for GEMT, so they're averaging per transport about $900 compared to $500 in our system right here. Within our districts, I am betting that our 3 districts, I haven't seen the numbers, but our 3 districts bring that average up a lot. We have probably a higher levels of insured populations within our service areas versus the Vancouver service area portion. So we have less poverty pockets and just different income brackets and different things. So our payables theoretically raise the overall average from our districts, which plays in it somehow. Now, something I want to emphasize is one of our goals, my goal as I'm looking at this and what I've been tasked at least with is not to replace private ambulance. We're not looking to build a ambulance system or of our own. The goal is about finding creative ways of funding that subsidy other than a cash payment. Are there other methods that we can do that don't require a cash payment to make the system viable? I don't think any of us want to take over, based on conversations I've had with a lot of folks, want to get into the full-time ambulance business. Public-private partnership is probably more efficient than that. So creative ideas there. And the days of 100% user fee paid systems are gone. That's what the consultants are saying. Those days that we've been living on just aren't going to happen moving forward. They will have to be subsidized in some form moving forward. So, and of course it's a long-term issue. If we don't do something now for this next RFP, we're going to be locked into another 5-10 year contract again. And I don't think any of us want to do that. And who knows what that subsidizing fee will look like and what that does. So we really need to be looking at long-term solutions here and engage this issue. So it's kind of a quick, down, dirty overview. I don't want to repeat stuff I have in front of you that you've already read. So
I think I will repeat one of the things he said, but just a reminder about the response times. Right? So Fire District 6, your fire district is wholly within 9 minutes. Yeah.
9:59.
9:59. Nearly all of or CCFR is 19:59, so it's 20-minute response time. And one of the things that I brought up during a mid-contract review a few years back with AMR, said, hey, we've had significant changes in our population, and that we have a lot more calls, and those times are based on, when it says high density, low density, it's based on call density, not population density. But population drives call volume. And so we were having a significant number of uptick in calls. And they said back 5 years ago, well, the only way you're gonna get another car in the system is if you pay for it, right? So if you wanna pay $500,000 a year, we'll put a car up 12 more hours a day, and it'll cover your area, right? So I think for Fire District 3, excluding a box around Battleground, most of the area is also 1959. So one of the things Chief Peeler talked about has been floated is, one form of making that right is to increase response times. And so for an area that is at 9:59 now, does it hurt that much to go to 11:59 or 12:59? But for the areas that are already at 19:59, now you're talking 21:59 or 22:59, and the ambulance only has to hit that 90% of the time. So that essentially becomes not the county or the cities subsidizing the system, that's us subsidizing the system, because we are now on scene longer, less available for other emergency incidents that are happening. And for us, who generally, the heart of what we do is serve our public, and when our public's not getting served because we're sitting on the scene over here, it starts driving us to want to put more units in service. Well, that costs more money, just so we can cover the calls that we're not able to cover because we're waiting on an ambulance. So there's cash subsidies, and then there's non-cash subsidies. So the change in the response times is a kind of a non-cash subsidy, but it impacts us directly as opposed to the cities and the county where cash payment may come from. So
Yeah. Currently, we have no say in any contract right now. Like was talked about, it's EMS2, but City of Vancouver, even if we were to put an ambulance we have in service right now and start doing some transports, we'd be in contract violation right now. Without the explicit permission from AMR and the City of Vancouver on the contract, none of us can do anything at the moment to improve the system. So, and that's some of the stuff we should talk about to be in the RFP, future RFP, is how can we be more engaged on changes as populations continue to move around and we get busier.
Chiefs, did we kind of hit the main issues here?
Yeah, I'd just like to point out, one of the key players is not here as well, and that's Fire District 5. So that EMS District 2 has Fire District 5, 6, Clark-Burr, and 3. So, sorry.
I'm sorry, Vancouver's made it really clear that, every time I bring this up, that 5 is actually, because it's served by Vancouver. I'm not sure how this happens, because, but it
5 is not included in EMS2.
yeah.
Okay,
Well,
well, never mind then.
So Vancouver will pay their percentage of the subsidy that would be required.
Yeah.
The call breakdown here of 67% of calls in the COB includes that whole Vancouver response area, including Fire District 5. And then the other 33% is our 3 agencies.
And that's, it's been pretty consistent over the years. What's been interesting is as the call volume goes up, it stays at pretty much the same breakout for our 3 districts. District 6 has about 17% of the overall county EMS calls. District 3 and and CCFR each have about 8% of the county, of the EMS calls in it.
So
In EMS, in the areas served by AMR, which is City of Vancouver, Fire 5, and then EMS 2.
sorry, I didn't catch those numbers. These 3 districts represent what percentage of calls?
33%.
So 8% for CCFR, 8% for Fire District 3, 17% for District 6.
I think it should be said too that, before Vancouver took the contract, it was through Clark County, and the idea all along, for years and years, was we would do better together. And I think ideally that's true today. If we have a system that works for all of us, it's gonna be a better price. But all the things that have been pointed out are the issues that we have to get through to get there. The previous administration of Vancouver Fire was difficult to work with, this one isn't. It's a different arrangement now, however, they are administering the contract, like was mentioned, we are not. So I, maybe I'm too hopeful here, too optimistic, but like I said, I think we should recognize that the best case scenario would be that we work together. Whether we can do that or not is the question.
Yeah, we've not seen any indication of Vancouver wanting to cede any control over the contract.
Chief, just for anyone that might not know, EMS District 2 could not put out an RFP and expect anyone to even bid on it. Is that correct?
We could, but it would cost more. We are, if, as a tag-on, it's less of a subsidy. But EMS2 can put out its own RFP.
If we, per the numbers we've seen from Vancouver's consultant so far, if we all stay in it together, the total amount of subsidy to the system is a certain amount. But if EMS2 breaks out and says, we're gonna bid our own contract, and Vancouver and Fire 5 bid their own, the two numbers actually add up to a higher amount. So we, staying in the system benefits the city of Vancouver because they don't have to subsidize it as much.
City of Vancouver is motivated to keep us there.
But to answer your question, Commissioner, let's see, when I say we, that's not we in the room here again.
It's EMS
EMS2 could put out their own bid for a contract.
So EMS District 2 is the county councilors.
It's
And then
two-
there's a council below them?
No,
Or it changed?
It's, EMS2 is 2 county councilors and 1 small city rep. And so the current ones are Councilor Bowerman, Councilor Marshall,
Yeah, okay.
and then Councilor Shane Bowman from the
But
city
they
of
sit
Vancouver.
on the council.
Uh,
EMS council, they sit on that, is that true? Or are they in the EMS District 2 board? That's what I'm confused.
They are the EMS2 board.
Okay.
Yes, so those 3 people make up the EMS2
Okay.
board.
That's why I was confused. A while back, wasn't AMR allowed to rent some BLS ambulances on certain calls? Isn't that somewhat of a subsidy?
Yes.
It was a mid-contract change that was allowed as a pilot program. So the current contract allows pilot programs to be performed through the contract, and that pilot's ongoing right now. They've added 2, depending on hours. I don't know how many total unit hours, but that is a change.
And where it gets to be a subsidy is we end up sending our firefighters in on those transport units.
So
If
that's
it becomes
subsidy.
ALS, or you get a BLS car on scene and then they have to stay on scene and wait for ALS response. So that is a subsidy. That's not a cash subsidy, but it is,
It's a subsidy.
yeah.
Overall, I think the BLS cars has helped with the problem for the frequency that our medics, I can only think of one call CCFR has had to send our paramedic in the 6 months the program's been live. Only one time have we had to send a paramedic, so I don't know how many times the other agencies have, but overall, the BLS cars have helped relieve some of the strain in the system.
I believe the medical program director, Dr. Whitwer, had talked about allowing that what do you call it, pilot program to continue on for another period of time.
Year.
Because the data period was too short to make.
Do we know how the new medical director is gonna feel about it?
He'll be fine with it, yeah. Some value that AMR does bring to the table also is AMR is very interested in helping solve a lot of the unnecessary transports and different calls. They are 100% funding the nurse navigation line that was implemented in the county. And we are noticing impacts from that, or a decrease in calls. So those are taking some, I don't have those numbers off the top of my head, but AMR is making efforts, including that pilot program on BLS and the nurse navigation line to help the system. So I do want to throw AMR a bone, and some of the AMR issues that they're having also is that a lot of us are doing a lot of hiring right now. And AMR paramedics keep getting plucked away. So some of the staffing challenges AMR has is directly correlated to our hiring as well, so.
So would a subsidy, theoretically, you guys have purchased 2 ambulances, right?
We've purchased one, we have another one.
Okay, so in theory, if AMR is level 0 and they aren't gonna have an ambulance cleared for 20 minutes, would a subsidy be putting an ambulance in the system and transporting that person on their behalf? Is there some way to work that? Or,
What we're told on that is us just taking their level 0s does not decrease their cost.
decrease their fines?
Yeah, I think their fines might still be there on that one, but it doesn't decrease their cost. So what they've said before is they're working on, supposedly tomorrow, we're gonna get a number from them of how many calls would have to come out of the system to actually do away with a subsidy, a cash subsidy. So we're hopeful that numbers, we've been promised that number for a couple weeks, and hopefully tomorrow that number will come. But just taking level 0 from AMR, there will still be a cash subsidy that has to be done because now the benefit is that benefits the patient, and that is us benefiting patients, taking care of our citizens, and freeing up our crews faster. So that's the benefit there, but it's not offsetting the cash subsidy that.
But if you transport it and let AMR bill and keep the money, that'd be a subsidy.
The truth of the matter is even though we don't have ambulances at District 6 and they don't have them at District 3 and Clarkford does, and we don't have ambulance licenses at 3 and 6, but Clarkford does, any of us can transport according to the Department of Health in an emergent situation, a level 0 situation, or a long response time. The difference without having that ambulance license is we can't bill where Clarkford could. But because the current contract has exclusivity and AMR is the only transport agency allowed in the county, none of us could do it, ambulance contract, ambulances, personnel, no matter what. So that's part of the contract that we really are looking at when we meet with them, is to look at that.
I have a real hard
clause.
time, sorry, go ahead.
No.
I just say, I have a real hard time as a commissioner when we have apparatus and the trained personnel, the equipment to transport somebody, and we're handicapped by this contract to not do it because it's detrimental to our other fire service partners. So
And the public.
that's one request that I would like to see made, and one change made in this next contract is that we have some, at least some terms and conditions and when we can do this for the public's betterment.
And some I'm hopeful for in '24, since the ambulance we have, we're gonna staff it going next calendar year. I don't know what the actual date will be. We've guys in the academy, folks in the academy and training and different things, but first quarter of next year, an ambulance will be staffed with 2 running first response. Essentially, everyone else's district has squads, 2-person squad. We're gonna have a 2-person ambulance able to run first response
So
right now.
we've talked about this, so I'm gonna clarify for Chief Peeler right here. That is a 2-person response unit. It could be called a rescue, it could be called a medic unit. It's not an ambulance, because an ambulance takes people to the hospital. And generally in the county, right now, in our area, ambulance transports are done by American Medical Response. So we're going to put a unit in service that is transport capable, but until we figure some of this stuff out, it's not an ambulance.
And one potential solution that we got to chat with AMR about is AMR right now has a mutual aid agreement with Camas Washougal and North Country EMS. So into '24, what we'd like to see is potentially a mutual aid agreement with CCFR.
They won't come into District 6.
What's that?
Camas or
Correct.
North Country, we're stuck.
Correct.
So we want to be able to transport into level 0 situations. Right now, because of the contract, we can't. But if we have a mutual aid agreement with AMR, that when they're level 0, that response vehicle can then transport. That's one potential solution for at least next calendar year to help the system out and help our patients out. So
As a pilot program?
Well, that, they can
Next
sign
bid.
mutual aid agreements with any entity, so that would just be a mutual aid agreement that they have control to do.
Would
And they,
that be a billing incident to us?
yes, we would be able to bill.
So we could run to District 3 or District 6, level 0, and we could bill.
It would depend on what parameters CCFR and commissioners would open that response up for.
And AMR would be the one
So these are things we're exploring,
to, right.
right? And so we weren't here tonight to present these as options. We're more here tonight to present to you that there is a problem. And we're not gonna resolve it in one meeting, but we want you to be aware of what the problem is, because it's going to impact all of our entities here. Commissioner Losbeck, you were absolutely right about, you know, taking somebody because AMR is at level 0, because it's the right thing to do, right? We care about our citizens. That's what I mentioned earlier. That's what we're here for, is to take care of people. And what Chief Peeler mentioned though too is us taking, or any one of you, even if you know, District 3 has an old ambulance, they could outfit it and in that
Well,
situation,
we
take
could
somebody.
transport with it right now and then ask for forgiveness.
Yeah, right. But it doesn't fix the system. And that's
No,
the issue.
and I think, you know, you talk about you guys transporting, I think the only real solution in my mind is that we all get transport license, and we approach from that angle, to, you know, to cover the area. Because just one is not gonna do what we need.
Yeah.
And I think Chief Sorensen has a good point, that this is really a system. It's a district, and so what one of us does individually could negatively affect the other two. And so that's why it's so important that we're here together talking about it, because if we don't attack it together, we will negatively affect our partners, and we don't want to do that. But I think, you know, I think one of the main focuses for us is that exclusivity within that contract, and that's one of the areas that we really need to focus on. The other areas, like some guidance from the boards for you to consider over the next month or so, is whose responsibility is this subsidy if we have to do it? Is it the counties? Is it EMS District 2's? Or is it the fire service? But we are public service entities, we collect taxes, and it doesn't seem right to use that tax dollar to subsidize a private agency. So those are kind of the questions we need the boards to consider to give us some direction in that contract.
Chief Nora, you mentioned two words at the start of this. They said, we can be involved or we can be informed. So, in just talking with Chief Sorensen a little bit, it does seem like Vancouver is open for us to be involved in this. And I think a lot of the things that we've talked about tonight, we I guess, having a seat at the table and being part of fixing the overall system, I think the county does need to be involved. I haven't heard much of what the county District 2 board does, other than call themselves a board, but let Vancouver run it. And so I think the county needs to be involved, since we are just part of their system. That the county has teeth in this game. And so as we reimagine EMS, the contract in this county, there are multiple players that have to have multiple pieces. And we cannot just be informed, we must be involved. And I think that's the key.
I absolutely agree with you on it. I'm always the guy looking for an analogy on something here, but, so, we're all on the bus this time, but Vancouver's making sure that they're the driver. But at
Is
least,
it a short bus or a long bus?
it's a pretty short bus, but at least we're in there screaming what we want this time that they can hear us. So, you're absolutely right about that, and one of the things that, that the chiefs we had talked about is, after at least putting this on your radar collectively, that we think it would be important to maybe have a meeting with one of the county councilors, you know, all of the EMS 2 board, if they will come meet. But at the very least, you know, we have a good relationship. Sue Marshall serves the area of both Fire District 6 and CCFR. We have a good relationship with her. I would hope that Fire District 3 has Shane Bowman as an elected official within their area. But if we could get a couple people here to say, are you aware of that? Because What I have seen over the last few years is EMS2 board is meeting one time per year, and that is when the city of Vancouver and the contract provider, AMR, tell them how it's going.
How great it's going.
I did, I was gonna say that
Sorry.
part too, but yes. They get there and tell them, hey, we're doing a good job, what do you think? And it's a big hurrah, yeah, you're doing a great job, thank you. And we are not able to come forward, and we're on the receiving end of it, right? So most citizens won't see what the service is like unless they're the ones who called 911. But we see it multiple times a day because our crews are out there doing it and serving each one, the vast majority of those calls. So we do need to have EMS2's board here, and they need to understand what their role is and our concerns with where it's going.
So, I ran a quick report on First Watch, which I don't think is even 100% accurate. But year-to-date, the captured ones, 414 level 0 occurrences year-to-date in Clark County. So it's significant. And I bet there's easily 200 plus more than what's reported to CRESA, and that CRESA gets into CAD.
So chiefs, follow with Rick, is the best place to try to insert ourselves at the Vancouver level? Because it sounds like EMS2 doesn't do anything. We need to get into where the contract's being written to try to get our needs in there?
It's an ownership thing also. What level of ownership does the fire districts want on this problem? Right now, it's an EMS2 problem that we're suffering from. So,
Is it possible for each district to have a member on the EMS District 2 board?
I think that we need to ask EMS to reconsider how it looks and be a part of that. And people that were here in 2013 when this process started would probably be able to answer a little bit better than myself. But I've heard that the fire districts were excluded, but I've also heard that the fire districts kind of chose not to be a part of it because the train was heading in a direction they didn't want to go. And so let's see where that goes. But the fire districts were not on the EMS2 board previously. But it's probably time that we at least have a better seat at the table there because we are the service providers.
Isn't EMS2 elected officials? Would they be open to chiefs or whatever, or do they have to have elected officials? So if that's the case, where can we insert ourselves?
So it's a bit of a two-pronged approach, and that's continuing the relationship with the city of Vancouver through their fire department, because that's the point of contact for this contract, and working with them. But at the same time, ultimately, if we get to an impasse, Vancouver will say, you guys don't really have a say here. EMS2 is the entity that will piggyback on this contract if they choose.
yeah, Vancouver's already asking, it's like, why are you guys willing, when we ask them to model different things with their consultants, like, what does it look like if an ambulance from fire districts jump in there? What does it look like that? And they're like, why are you guys trying to solve EMS2's problem? And I keep having to remind them, we're not trying to solve their problem, we're trying to take care of our citizens, improve service for that, and free up our crews, keep our crews available. Because EMS2 doesn't know on that part. But yeah, right now it's an EMS2 problem. How deep do we want to go and start taking ownership of this as fire districts?
But the truth of the matter is we have to start with Vancouver because EMS District 2 doesn't tell Vancouver what the issues are. And so that's why we inserted ourselves at that level, is Vancouver needs to know what the problems are in the other areas, and that's what we're doing now. The next step is to insert ourselves with those elected officials and talk to them, maybe not in a formal setting, but educate them on EMS District 2 and how it's affecting our agencies.
And right now it appears Vancouver's satisfied with status quo and paying and aware that their city will have to pay to subsidize the contract. And they're okay with that from all indications. You know, it hasn't gone to council or anything yet, but that's the direction they're looking at.
They're also at 9:59 response times all across the board, so.
As I say that, there may be, and I bet Scott, you might know more because of where you run over, there is a portion of Fire District 5 that's rural, that's quite a ways east, that's still Vancouver's response area. that may be in 1959 in the far east end of their district, but for the very vast majority is 959, yes.
They pull Camus into that quite a bit.
They have, they were doing it, and Camus and North Country got together and said, we're not going as much, so that's what Commissioner Losbeck talked about. Camus no longer, if AMR's out of ambulances, Camus won't go north of 28th Street or west of 205, and AMR will not, or excuse me, North Country will not come south of 179th. So it helps us, and it helps 3, but it does not help 6, because they aren't in a zone where they get the assistance.
Yeah, they put a geofencing CAD on that, so when AMR's level 0, that's all the further their current mutual aid will go. And that geofence was built on data of the system, AMR time being able to free up ambulances from hospitals versus how long it takes from Farger Lake for a North Country ambulance to drive down. So it was data driven on how those geofences got established.
So where do we go from here?
So, we have a lot of questions that we don't have answers to. I think we all want to be involved. So I would suggest to keep us all apprised of everything that's going on and all working on a level playing field, that we all go back to our respective districts and create a subcommittee where each of us send an elected official. So it would be one representative from each board and their chief to work on this. It's very hard to get 11 board members and staff all in the same room, and it's really hard to fit them all into one county office if we have to go to that level. So that would be my recommendation.
I think that's an excellent start. We can at least start working on distilling the problem, keeping people pretty well informed so the boards can stay informed.
Yes.
If the boards are good with it and the chiefs are good with it, I would suggest the chiefs reach out to Councilor Marshall and at least start the conversation there with her, so she can bring it back to the board. And one of the things that you'll notice, if you read in the Columbian, Councilor Bowerman's been ill and she's not attending a lot of the meetings anyway, so I think it'd be hard to pull the full board together right now, but we at least, as we move into 2024, this RFP process is gonna take off pretty quick, and we need to make sure, we're being watched out for.
What sort of timeline are we looking at?
We'll know more definitively tomorrow on where the RFP process is, but last we heard late December, early January is when they want the RFP to go live.
The Commissioner, to answer your question, it's up 12/31 of '24, and so they would probably need to identify a new contractor by July, August, September at the very latest, so that they can start lining up.
But they're looking to put their RFP out here in a month and a half or 2 months.
Yes.
Yeah, we are 0 hour.
Yep.
It's the Monday.
Right?
So, next Monday, the 13th, the Vancouver Fire Chief is presenting, Chief Blue's presenting to the Vancouver City Council an update on this. I'm not sure if he was saying it tongue-in-cheek or if he was seriously, he's like, you guys can come if you want. Okay, we'll be there. Or at least I'll be there. I want to see what's going on with that presentation. But
6 p.m.
6 p.m.
Yeah.
Thank you. So we'll at least be able to get some information there as to where VFD says the contract's going. And we point to VFD, but really it's the city. It just happens to be that it lands in the fire department's lap, but it's they're implementing the contract for them. And we could maybe start working on some of the questions, that Chief Peeler outlined as to, what are we to the system? We know we're first responders in that, but how much voice should we have in that system? And if a subsidy needs to happen, if they get down to the point and say, hey, to get this bid right, we're gonna change some things, we're gonna subsidize it in this way, are we willing to politically stand up and say, hey, that this either is or isn't our problem.
Do you know ways this has been subsidized in other areas? And also what Vancouver plans to do to subsidize their portion?
We don't know what the subsidy is yet. What we've heard kicked around is it's gonna be a cash payment to buy more response from AMR, to put an additional unit in service. They did cite a couple places that are doing this. Contra Costa County, California, is doing that, and I forget, Chief, what, if they were putting units in, or if they were buying units. Are they buying
Credits.
they're using fire department money to buy unit hours, so to have it more ambulances in service for longer. San Diego, City of San Diego did it, but they essentially opened up so another ambulance company could overlay that, and they would have enough ability to do that. But here, when you're in a area that has tens of millions of people over 100 miles, you're gonna have a lot more service than you're gonna have in this area where we don't have that many ambulances.
So with EMS District 2, basically all they do is manage the contract, or as a rider, which is currently a pass-through. Are they a junior taxing district? Do they have any money at all?
No.
That's what I thought.
They have fine money.
They do have approximately,
Oh, they're the ones who get to hold the fine money. Gotcha.
they're holding, at last count, which was about 2 months ago, $240,000 in fine money.
But they don't have a way to, they don't currently have a way to bring in revenue.
They,
No.
so they could be a taxing district, they're not, but they could be, similar to North
So
Country. or
North
something
Country
like
EMS is actually EMS District 1 within Clark County. And EMS District 1 runs an EMS levy. That's what pays North Country EMS. Our districts have EMS levies, so if EMS District 2 wanted to run a EMS levy, they can't, because 2 of our 3 districts already have, and part of District 3 already has one. So that's their primary funding mechanism for EMS, where a subsidy would theoretically be paid from.
Okay.
If I understand, the only person, or the only company that'll probably bid will be AMR. Are there anybody else that would step in?
Potentially Falk. There is potentially another bidder out there. And Fitch and Associates did cite communities where private ambulance companies, AMR included, have withdrawn from those communities because they can't afford the service anymore.
So if the commissioners are good with it, I appreciate the suggestion that we have an elected rep and a fire chief on a small committee that can start making these contacts and trying to get a better understanding of where it's going. But as we work with Vancouver, we also want to make sure we're working with EMS too, so that all the right communications are happening. You guys agree with that? Again, as firefighters and the elected officials for firefighters, we're generally very much can-do people. So it's difficult to call you to a meeting and say, here's the problem, and we don't have any answers for you. And don't give us anything when we leave and all that. But we just really, we solve things, we fix things. And tonight we weren't looking to leave with the fix. We were looking to inform and start the process for fixing some things.
And to reemphasize, 10 years ago, Vancouver didn't allow anybody to have a seat at the table. They took that contract and they ran with it and said, you will get what you get. And the current administration of VFD is sharing data, is engaging with us. So that's a significant improvement from 10 years ago. So we definitely need to show appreciation on that front.
Well, they've also realized that we helped them out.
Yeah.
We helped them out 10 years ago and they didn't care, but even more so now.
But it just seems like our EMS system has taken a step backward when that contract flipped to Vancouver holding it. Our response times increased in CCFR at that time to that 19 59. And for them to make 1959, 90% of the time is, when these crews are on scene, you know, the stroke patients and cardiac patients.
I
It's
just,
not
I'd
an
like to
acceptable time period.
add on to that, though, I think the fire agencies have upped their game. District 6 been doing it for a long time, we've upped ours, Clarkford has, and we provide more ALS and better EMS.
Absolutely.
The problem's been the transport, that's
Mhm.
where we're falling down. And if we could pick that up, then we'd have a solid response system.
Yeah.
So I wouldn't agree that the whole system's failed,
No.
or worse than it was.
No, but our response times have increased. So,
Yeah.
point that out.
The ambulance part.
And there are some other factors that have happened too, the last few years that have impacted hospitals, backlog, COVID, all those things. It's been a challenge too.
You know, Chief Sorensen figured out that there's a lot of nuance to things, right? So when Chief Maurer says, hey, if one partner does this, it affects the other partners. Well, one of our partners that took an action that has an effect is Vancouver Fire. And they stopped going on certain call types, certain low-level call types, right? And I absolutely understand why. There's some calls we don't need to be on. But the effect is AMR still goes. So that takes an AMR ambulance out of the system, that the closest fire responder doesn't go assess the patient and say, hey, slow to code 1 or you're canceled, right? So if AMR is the sole responder in Vancouver and Fire District 5, their units are all on calls that nobody else is getting there and assessing. And so it's keeping them out of the system longer, and the trickle-down effect is we wait longer. Well, we not technically stop the clock, that's not a term that we use in this contract, but when we get there, we essentially are at least keeping the situation from getting worse. We're stabilizing it, and maybe we're making it better. But we're waiting, and that waiting allows the system to be subsidized by us on scene. So I think it was one of those little things that until you pointed that out, I was like, hey, wait a minute, you're right.
Well, and there are times
subsidized.
where we cancel AMR, puts it back into the system because we're there.
So, yeah, sometimes good ideas have unintended consequences.
And it is a problem for Vancouver, they've got a numbers problem with it, but that is what's happening. It's a reality.
Well, I gotta ask probably an obvious question, but there's a piece of this that I'm not understanding, and forgive me for my ignorance if this is a silly question, but what is it in the system or in the way things work that a private entity needs a subsidy? You know, if we put out, if an RFP is put out, why don't they just crunch the numbers and say, here's how much it's gonna cost and charge that much? I know that there's Medicare and restrictions.
It's based on
Yes.
what we're asking of the contractor. We're asking the contractor to provide X number of response time. We're controlling the parameters of the rules they have to do. If they come in, just run it for no subsidy, with no oversight in that, that's what's driving that, is that, the parameters of the contract.
But it's also a user fee model, and so the user fees are not sustaining the need anymore. So that's why they have the need for the subsidy, is because they can't collect enough money from the transports to support the system that we need.
We're paying a contractor for work, for performance measures and work.
So with Dean's question, can't they raise the
Why aren't they
call
just,
charge?
why, that's what I'm getting at.
Yeah.
You know, if it's $500 per call right now,
Because
per
people don't pay.
transport, why don't they just bid $800 per call?
Yes, one of the gaps is the current fee schedule is the lowest, the base rate schedule that is being charged, and that's something they identified, so that will be increased. Vancouver's committed to increasing that, and that's gonna offset that subsidy requirement. But it still comes down, Medicare, Medicaid only pays X. So that fee is getting passed on to the insurance companies to pay, but they're paying higher rates elsewhere, so let them pay those here. So that is one thing that's going to cut into that figure, that subsidy cost, is by increasing those base rate fees.
And just to be clear, the average collection rate is $500. It costs way more than that to be transported by the ambulance.
I get that, and I guess what I'm not understanding is why can't AMR or anybody that bids that take in all these factors and figure out what they need to charge for a base rate? And say, this is what it's gonna be when they answer the RFP, instead of asking for a subsidy.
Good part of it is they still won't get that. They can charge the base rate, but they still won't get it. And a lot of the people they transport are either on Medicare or Medicaid, and that's capped at a certain amount. And so if that's the insurance that a person has, Medicare says, we're paying $400 a ride. So you could charge $2,000, you could charge $3,000, but a certain number of your transports are still only gonna get you $400 a transport. I understand, that has been explained to me, is we can keep raising our price, but what we're getting doesn't keep up with the price rises. One of the things that Chief Peeler mentioned was GEMT, which is Ground Emergency Medical Transport, and public entities can recover some fees that are in addition to Medicare for that. So I don't have the average number per incident, but some of the public transport entities are catching.
Yeah, what GEMT is doing for North Country and Camas is adding about $200 per transport on there. But GEMT money is at-risk money right now. Too many people discovered that well. Washington was one of the first states to dip into that well nationally, and other states have seen that, and that well is not deep enough, and the GEMT money's rapidly going down. But right now, North Country and Camas, because they're public agencies providing the transport, get $200 more than AMR's eligible to get.
I think it's still worth asking that question.
Yeah, I was just saying,
Because-
we'll ask that.
The insurance companies are likely going to pay that, so then the question is, how much difference does that make?
That's
Unless
what
it's
that's
$5,000
kind of what I'm getting
transport.
at is, I understand everything you're telling me about the restrictions on what they can charge as far as like, Medicare and the like, and uninsured, and what percentage they collect, their collection rate. But they have those numbers, they can factor that in to determine when we get somebody with insurance, here's what we're gonna charge. And if they have to raise that up to make up for these other factors, I don't understand why they can't do that instead of asking for a subsidy, or basically demanding a subsidy, or we're out of here. I don't get that.
Wouldn't it seem like their real call load is us old people on Medicare, Medicaid? That's the bulk of everything, and the few younger people, they'd be paying this. It just
And that's how it currently is.
Yeah.
That's how it works today, is Medicare and social, and those payments are capped at a couple $100s.
What I'm saying is, does AMR have enough of the other business to even make up the subsidy? How much would that have to be? to make
Vancouver's
sense?
running that number right now. That was part of the thing from a meeting 3 weeks ago that they did, because they just discovered how low the current rate is in the county. So they're running how much they can increase the rate and what that will do to any projected subsidies.
So Vancouver is setting the rate that they can charge?
In the contract, City of
Okay,
Vancouver
that
sets the
hadn't been
contract.
mentioned,
So City Council establishes the fee structure for.
Got it. So AMR can't just bid, here's all they can charge by contract.
To clarify, though, it's not AMR saying, if we don't get this, we'll leave. It's the city's consultant saying, we're looking at the system and we don't think anybody's gonna bid on it at that price because they can't make money on it. So that's why prices have to come up, or cash subsidies have to come in, or timelines need to be extended, and so it's not nobody's bid on it yet. It's the consultant saying, we think nobody will bid on it if you don't make these changes.
In the last couple of years of the current contract, AMR has been in the red, based on the data that we have.
We just don't know what the county's position is, because the county is.
EMS two.
We'll work with the chiefs, come up with kind of a next steps plan. And if each district can, if everybody's agreeable to that, designate an elected commissioner for that, we can start gathering some information, making some meetings, and just try to get information coming in that we don't have, but also pushing some of this information out to people that don't have it. Anything else on this?
Any other?
I think, as with the impact fees, everybody in the same room together has a lot of pull. And so I'm, again, very appreciative to have everybody in the same room and talking the same language, because I think that is going to pay a lot of dividends.
Yep. Any other questions, comments, concerns? Okay. Without any more information, I don't know, it's hard to set another meeting date, but I would like to continue to see us meet, obviously. Okay. With that, we'll come back into regular session and adjourn.
But you got the citizen comments?
Oh, sorry, we have to, citizen comments. Nothing on here? Okay, any citizen comments in the room? Okay, now we'll adjourn. Get right over it.
So, just in case you guys